like to begin by giving you the official definition of the chain of command. The official definition of a chain of command is an official hierarchy of authority that dictates who is in charge of whom and whom permission must be asked. For our community at SUNY Canton Nursing, our chain of command is as follows. Initially, it is our instructor. I'd like to thank our advisor as well, who can help guide us to which direction we should go, no matter what the complaint be. But initially, it is the instructor. And it's the instructor that you have an issue with, not other instructors that you have for class, but the actual one that you have the issue. Then it is Dr. Kim Davies, Dean Ken Erickson, Provost Dr. Peggy DeCook, and last is President Dr. Zafran. I believe that our responsibility as students mirrors an actual job, and it's getting us prepared for doing a nursing job. If we were an employee at our place of work, a chain of command would have to be followed. We would have to go to our supervisor first. For example, say you call the owner of the company because your supervisor is making you mop the bathrooms when it's actually the supervisor's job on that shift if she's working the floor. Do you think that the owner of the company is going to listen to this? Chances are it's never even going to make it that far. It'll quickly be dismissed. And it's very disrespectful to your actual supervisor. In my real job that I get paid for, I work for the state of New York. If we break the chain of command, nothing's entertained, no matter what the complaint is. You have to follow the steps there. In fact, if you don't follow the steps, disciplinary action can happen. And then your complaint, and it may be very legitimate and very bad, isn't even going to be looked at. And it loses its fuel before it gets where it needs to go.
The example we chose to discuss is a scenario in which a nurse believes that a provider is impaired by the use of alcohol or drugs. As a nurse, we'll work directly with MDs and after a while get a sense of how they communicate with us and how they communicate with their patients, as well as how they carry out their daily responsibilities. In this scenario, an RN would be working at the bedside with the patient. A provider would enter the room and just seem definitely out of sorts, fumbling over their words when speaking with the nurse and when speaking with the patient, incorrectly performing assessment on the patient, having trouble remembering simple details about the patient's condition, and overall appearing intoxicated. Maybe their pupils are too small or too large, indicating drug usage. Maybe there's a smell of alcohol, any of the above. In this scenario, that would cause concern for the nurse, patient safety concerns because the doctor would not be making clear decisions for the patient. And so hopefully the nurse would follow the correct chain of command to address this problem. In the next clips, we will discuss how a registered nurse, as well as how a student nurse, would correctly follow the chain of command in this scenario.
If you were working as a staff nurse and you suspected that a provider was impaired, you should report them to the person above you in the chain of command. As a staff nurse, that would be the charge nurse of your unit. You should report your concerns to them as soon as possible. If the charge nurse dismisses the problem and doesn't act to address it, you should report to the next person in the chain of command, which would be the nursing supervisor.
As a nursing student, when you see something wrong, it can be really hard to challenge that or speak up and say, hey, this is wrong. But it is your moral obligation to do so, especially if it comes to keeping your patients safe. So if you see something that's wrong, you're obviously going to start by going up the chain of command. You're going to talk to your clinical instructor and see what your clinical instructor wants you to do. Many times your clinical instructor will bring you to one of the nurses, and then you can talk to the nurse, and then you're going to go up to the charge nurse if the nurses tell you to do so. After the charge nurse, the nurse will tell you, okay, I'll take care of it, or they'll tell you to go to the supervisor of all nurses. Then, depending on what that supervisor says, you're probably going to go to the unit manager. The unit manager then can make the decision on if you should go to the assistant director of nursing or stay right with her and she'll take care of everything. And then after the assistant director of nursing, you're just going to follow what an RN would do at that point. RNs obviously have a little bit of a different route to take because they don't have as many resources, A, and B, it is their actual place of employment, so they don't have to go through a clinical instructor, and they don't have to go through nurses that are at the same level and or lower than them per se, but they have a chain of command they have to follow as well.